7, 6, 5, 4, 3, 2, 1.
Howdy, CROC Nation. Dr. Tommy and Ellie here with you for part 3 of 3. Professor Dr. Len Berry, welcome again. Finishing up the 3-part module on reclaiming healthcare's healing mission for a sustainable future. Len, thanks for coming. Angel Santana, have faith, let it begin. If any of our voices are slurring or you can't understand us or we're starting to drool or you see us starting to eat hoagie sandwiches, it's because this is hour 6 of this podcast that we unfortunately have been working very hard. Angel, you've been working like an animal. Len, you've been amazing. You've been such a good sport. Welcome back.
Thank you. Thank you, Tom. It's my pleasure.
So, Len, today you're doing all the heavy lifting for today. We're going to be ending because Angel and I have a saying on the CROC podcast. Not only do we elucidate and enlighten and bring forth the problems that our cancer survivor thrivers face, but we are always, asked as far as coming up with solutions, and that's what we're going to ask of you today. Today, we're going to end this 3-part series by looking at the discussion part of your article, looking at the research opportunities, looking at leaders who heal, looking at some of the charts. We're going to be looking at middle leadership, model generosity, and then finally, with my favorite group of people, the government, the U.S. government. Len, you're up.
Well, thank you, Tom. Thank you. So to promote healing, which is the true mission of healthcare, we need to promote trust. And so let me start with trust. Because everybody that is listening to your podcast, Angel and Tom, they're in a position where the degree to which they trust their clinicians, their doctors, the nurses, the health systems, the hospitals they use, is critically important to their well-being. And so I want to talk, if we're going to talk about solutions today, this is my favorite part. I want to start with trust. And there's 2 kinds of trust. There's competence-influenced trust, and patients usually have that. Tom, when you're patients, you see new patients as a radiation oncologist. They come in and they trust you to know what a radiation oncologist is supposed to know, to have the skills that a radiation oncologist is supposed to have. Unless you do something to alter that trust, they come in with that trust. They trust your competence because you're a doctor, and doctors are supposed to know what doctors know and have the skills that doctors are supposed to have. But there's another kind of trust that's really important for healing, and I call that kindness-influenced trust. And kindness-influenced trust includes the clinician truly listening to the patient. It includes empathy, understanding where the patient is from, what the patient values, what the patient's situation is, the patient's fears, understanding all of that. It's generosity, it's timeliness. There's so much untimely care where patients are waiting 3 weeks. They have a diagnosis of cancer, but it's 3 weeks before they actually get a treatment started, and it was 3 weeks of hell for those patients. Honesty, in our last podcast, we talked about gentle honesty, telling the truth to patients. Support for family caregivers. All of these are elements or dimensions of kindness-influenced trust. And the reason I wanted to start with that, Tom, is when you take competence-influenced trust and you put kindness-influenced trust on top of it, so you have these 2 different kinds of trust, that then has a much greater impact on trust. And then trust in turn has a much greater impact on true healing, and what true healing involves. And then I'll give you an overview and I'll stop. Is true healing involves improving the physical well-being of a patient when that's possible. But it also involves, true healing, mitigating the patient's fear. It involves sustaining the patient's hope in its multiple dimensions, and we talked about it in last week's podcast, the different kinds of hope. It involves anticipating the patient's emotional hardships, predicting when they're going to come in the course, in the path, in the course of illness, and being ready for the patient when the patient's going to have a particularly hard time. For example, before the first radiation treatment, Tom, that's an emotional spike for most patients. Not the fourth treatment or the sixth treatment, but that first treatment, that fear, what that's going to be like, seeing the machine for the first time, what that's going to be like. And healing can involve, just a quick example, Tom, I don't know if you do this in your clinic, but actually before the treatment start, taking the patient and the family and actually taking them into the treatment room so they can see the equipment and explaining what's going to happen before they have their first treatment. That's healing. That my definition of healing is much broader than just physical healing, because physical healing isn't always possible. Yeah, so let me start with that. Is trust promotes healing. There's two kinds of trust. And let me stop there and see what you'd like to focus on, Tom.
No, I love it. And that's exactly, as a matter of fact, Angel, I don't know if you remember, but those 6 points that Len mentioned, that was actually a module that we used from one of your other papers about, empathy and deep listening and kindness and all that type of thing. That was a beautifully said. I think taking it home, bringing it home, taking this paper, which again, I'm viewing as probably one of the most important papers that I've read, in my 35, 40-year career, because it doesn't just, basically, it's not just a doom and gloom, the sky is falling, Chicken Little kind of paper. It's a paper that's telling us that, listen, the system doesn't work, particularly in this country, which I think everyone would agree. We're all very, very fortunate to be living in the United States of America and be comfortable and be able to worship the way we want to worship and have freedom of speech and have all of the, all of the beautiful things that we have here. Yet to recognize that there's a great segment of our brotherhood and sisterhood of this country, of our fellow country men and women who don't have the fortune of being able to have access to the healthcare that most of us do, who aren't treated as well as they should be because of their age, or because we have a system that's in place where the people that are trying to heal you need to be healed themselves. So this is a very important article. And again, as I said before, solution, you go through so nicely and put all of these examples together of how we could make things better. But let's talk on a broad brush governmental level. We talked about the trillions of dollars we spend on healthcare in this country, and we talk about a 25 to 40% waste ratio in that number. We talk about these wonderful programs for the elderly that are significantly underused. Let's put it together, Len, and let's talk about from the top down, how we can make the future of healthcare sustainable.
Okay, Tom, big question, but let's give it a start. First of all, I think one of our key issues in American healthcare is we don't have an entity that's really in charge. And because we don't have an entity that's really in charge, we have a lot of competing institutions for making sure they get their share, if not more than their share, of the $4 trillion healthcare pie that we're spending today. Yes, we have the CMS, the government agency that manages Medicare and Medicaid. Yes, we have other government agencies that are involved in one aspect or another of healthcare. the Joint Commission that inspects hospitals for safety. We have a variety of agencies, but they're fragmented, they're not coordinated, just like healthcare is fragmented and not coordinated. And so we don't have what I call in the article an omnibus agency whose job it is to coordinate everything and that's basically in charge of improving the healthcare system and has the authority, has the responsibility, has the right people, including a lot of people with healthcare experience, people with business experience, people with patient experience, being patients, patient advocates. They need to be part of this omnibus agency. So that's that. I'll start with that.
Okay.
Until we have a more coordinated leadership in government for healthcare, it's going to be a difficult road to truly realize the opportunities in front of us from a government management leadership standpoint. But here's some things we can do. Here's the thing we can do. And if we had the omnibus agency in charge, it would expedite things. We need to move reimbursement more to what's known as a capitated incentive or reimbursement system. What capitation means is it means that the payer for healthcare pays an upfront fee to the health provider for taking care of the patient, rather than a fee-for-service system that pays for each service that's provided. The problem with the fee-for-service system, and I mentioned this in a previous podcast, is it incentivizes doing more and more and more because each service you do gets paid for. So whereas a capitated system that pays in advance a flat fee, that incentivizes doctors, clinicians, health systems, hospitals, clinics, medical practices to keep people healthy because they get paid a flat fee no matter how much healthcare services the patient gets. And so when you look at some of our most progressive health systems, for example, Kaiser Permanente, that Kaiser Permanente is both a healthcare delivery organization, but it's also an insurer. And it pays for healthcare delivery on a flat fee basis. And so Kaiser Permanente is so much more progressive than many other health systems in America, because since it's paying the insurance, it has an incentive to keep people healthy. And so it's done a lot more with telehealth. It's done a lot more with online. It's done a lot more in reminding and making sure that their patients do their screenings, get their screenings. You'll get a lot of reminders from Kaiser Permanente if you're behind on getting your mammogram, for example, or getting your colonoscopy, for example. You'll get reminder after reminder until you get your colonoscopy. We don't want to get colonoscopies, but we should, because we can actually prevent certain cancers if we get the right screenings, such as a colonoscopy. So one of the things the government needs to do is to change the reimbursement system. Another thing it needs to do is it needs to stop and prosecute all the cheating that's going on in healthcare, Tom. There's a lot of greed in healthcare. It needs to stop the greed. And so, you know, when you're inflating charges, so Medicaid or Medicare pays you more as a physician because you're improperly inflating charges. You're charging Medicaid in some cases for services no one ever provided. We need to stop that. There's a lot of criminality in healthcare today. I wish it wasn't so, but it is so. We need to create a national online healthcare performance dashboard, an easily used healthcare data dashboard that any patient, you, me, your Angel, your family, any patient, any family could go into easily online and see the quality scores of any healthcare system in the country. Yeah, see the quality scores, uh, the services they offer, the prices that they offer, the metrics of their care. We can do that. We have that data, but it's fragmented all over the country. We need to create a database that citizens of the United States can go into easily online and get all the information they need before they decide who's going to be my doctor, who's going to be my hospital, who's going to do my surgery, who's going to be my radiation oncologist. We need to create that, and we can. We have the technology to do it. We don't have the leadership in government to do it. And then we need to pay special attention and make a special investment on improving access and care to underserved populations, including the three I discuss in the paper: healing the poor, healing the elderly, healing the healers. So that's my starter list. And if we just did that, we would make so much more progress than we've made.
And Len, like always, you're so prescient in your thoughts. I wrote a couple of things down and you addressed every single one of them. I think that when we talk about medicine, modern medicine, we're so proud of our technology and we're so proud of all of the things we're doing, the molecular science, the individualized care in the cancer arena. But that changes a person's expectation, and then society expects to live forever, and they expect to have access to all this technology when it's not really data driven. It's more viscerally driven. You talk about greed, you talk about waste, you talk about corruption. 100%. This is where we have to make big changes in order to make healthcare sustainable. We talked about perverse accountability, is what I call it, or the medical legal reform that's necessary, because the way things are now, the way society thinks, is a very hostile environment toward the physician, where if something goes wrong, it's always about the doctor making things go wrong, not that it's the disease making things go wrong. You talk about transparency, you talk about quality. These are other things that your paper mentions, that we have to go in the direction of being able to do that. And lastly, the responsibility really has to be taken off of the shoulders of these for-profit business people that are driving healthcare in the wrong direction for their own benefit, and shift it to physicians who care, smart physicians, like Dr. Audish, like Dr. Hole. We need to sort of empower these types of physicians that are on the vanguard of trying to change things to make the healing process better. And if we do all of those things, then we have a chance of making an unsustainable system more sustainable. Angel Santana, your last thoughts on this marathon 3-podcast module with Len Berry.
Well, I want to first and foremost thank both of you. As a non-professor, non-doctor, but a producer, nothing is greater than seeing what hope actually sounds like. And I like to elaborate on that. First and foremost, to Len, thank you for being a guest here and a part of the family of the CROC Nation. When I think of you and all the work you have done, I think of the word kindness. And Mark Twain put it best when he said, kindness is a language which the deaf can hear and the blind can see. I believe that you and your work and your colleagues are allowing us to hear and to see the possibilities and what the future really can bring. And it's not without saying that your success has, of course, nothing to do with what you gain in life or accomplish for yourself. It's what you have done for others. And for that, I'm truly grateful.
Thank you.
Here. Len, I can't thank you enough. I said it on the first podcast of this 3-podcast series. There is no other that I think of with higher esteem than you, for your work, for you as a person, for what you want for this world. There's not much more that I could say than that. We are grateful and honored on behalf of the CROC Nation, on behalf of all the survivor thrivers out there. Your work on their behalf does not go unnoticed and does not go unappreciated. Thank you once again.
Well, thank you, Tom, and thank you, Angel. It's such a pleasure for me to participate in your podcast, and I hope you'll have me again. You two guys, all the nice things you said about me, I send them back to you. You two are really special to work with and doing great work. And good for you doing your podcast, CROC Nation. Good for you. It's a wonderful contribution.
Len, as far as coming back, sadly, you will be continually dogged and asked to come back on the podcast. You are basically one of the structural pillars for our survivors. So let me end the way I end all of our podcasts. Again, great gratitude, shout out, not just to Len, but the co-authors, not just of this paper, but of all of, as I said in the beginning, uncountable papers, books, presentations, influence, what he's doing on your behalf. We thank you. And we will end this podcast, as I said, as we end every podcast, with a blessing to our survivor thrivers. On behalf of Angel Santana, the CROC Board of Directors, and Professor Dr. Len Berry, wishing you all a long, healthy, happy, and cancer-free life. God bless you. God be with you. Peace.